Hi, my name is Amanda Finley. I'm with COVID-19 Long Haulers Discussion Group, and we love hosting town halls to give people with long COVID more information on all things COVID related, public health, and how they can make their experience better. So, married guest, introduce yourself, please.
Hi, nice to meet you. Thank you so much for having me, Amanda.
Oh, thank you,
My
Julie.
name is Julie Sullivan, and I'm the program director of the Long COVID program at Brigham and Women's Hospital in Boston. We're one of the first programs in the country and one of the biggest programs in the country.
No, thank you so much for all your work. And it's not just the clinic. I see you doing so much advocacy and making sure we all know, hey, there's a trial here. Go check this out. And I really appreciate that.
Communication and connection is a really big part of getting through this while we wait for treatments
Yeah.
and research to catch up for sure.
Yeah, and I think that waiting for the research and waiting for the treatment, that's a hard thing. It's a hard thing to grapple with.
It is.
That that there are treatments for alopecia now, and this happened to me 12 years ago. I looked everywhere. There were no answers at the time. Well, now there are several treatments for it. It was a decade later, and some of them are being tried for long COVID. So hang tight, everyone. Okay.
Yeah, the autoimmune component. Yeah.
Exactly. So, and if you're interested, Vanderbilt University, anyone watching, Vanderbilt University is doing a trial for baricitinib. It's a JAK inhibitor, and that's one of the things that you can look into. So, well, let's dive right in here with
Ready.
number one. Do I need a positive test to access a long COVID clinic? Why or why not?
Hi, you do not need a positive test to access care at our clinic. And there are two other clinics in Boston. You do not need a positive test for those as well. We understand that there were many times over the last 5 years where testing was not available, it was not feasible. So we go by your symptoms and it being connected with symptoms of a viral illness. We also gladly welcome people who have vaccine injury and post-vaccination syndrome.
That's really great to hear. Yeah, thank you for saying that. And that's we were talking the other day about some other advocacy interactions I've had, and one of the very first thing I told Representative Ayanna Pressley was, hey, the sickest of the bunch, we were sick in March 2020. Most of us never had a positive test, but we need that test to access care at a clinic.
Right.
And that was the first thing she addressed. So it's really good to see a lot more of this happening. We don't need that test.
Yeah, from the very beginning, it hasn't been a requirement. We just want to get you in and get you some help.
Right? Yeah, exactly. That's what we need. What can I best do to prepare for my first visit?
I think the best thing to do is it depends on who you're seeing and who your first point of contact is when you go to a long COVID clinic. Each one is structured a little bit differently. We happen to be housed in pulmonary because the early understanding was this was a respiratory virus and people would have more respiratory complications than it's turned out that they have. So I think depending on your first point of contact, kind of go in that direction. If you're seeing a pulmonary doctor for your respiratory symptoms, you want to be prepared to talk about that. If you're seeing neurology, then you want to be prepared to talk about specific neurological symptoms. If you have the good fortune of talking to a long COVID generalist, an internal medicine doctor or PM&R, then I would focus on the symptoms that are most impactful and the main points that you want to address first.
Yeah, and that can be a really hard thing. I made these advocacy cards, and on one side it has a QR code with a link to research on a given topic. But the other side, I have 3 lines on it so that you can, okay, what are the 3 top things you want to talk about? What are your priorities? Write those down, because you're going to get in there, and then after you leave, you're going to be like, oh, I forgot that thing I wanted to ask about.
Right, you'll start talking. We also encourage people to send information in advance to the providers. If you give it an, example of your history, talk about the problems that you're experiencing, talk about the treatments you've already tried, that's really valuable, and that they can upload that right to your medical record if you want.
That is fantastic. That really gives the context that I think a lot of us need when we go in.
Yeah.
With the shortened visit times over, historically, you don't get all the time you really need to talk about the whole picture.
So it's a really complex illness, and I know one of the questions was how long are the new patient sessions? At our hospital, the new patient sessions are 40 minutes.
Oh, that's fantastic.
So is that longer than most? I don't know.
Well, I think a lot of them, they try to budget between about 30 and 60, but it's hard to actually get between 30 and 60. And my first visit here in Kansas City, they already knew who I was before I even came. So we spent some of it, and we spent, I want to say, an hour and a half, but that was only because he knew, like, okay, let's talk about you. Okay, let's talk about everything else now. Everything not
That's
you. What do I need
great.
to know?
Yeah,
It was
yeah.
wonderful. Let's see. I went to my long COVID clinic, but all they did was refer me to a specialist. Is this normal?
I think it is, and the reason is that long COVID doesn't fit neatly into any one specialty. So pretty much every body system can be disrupted and affected by long COVID, and it doesn't. It's not a unifying diagnosis or a unifying specialty that it fits under.
Yeah.
So we rely on each specialist to address their specific body function. And so I know people can feel like they're being just referred to specialists, but my feeling is you're being directed to the appropriate specialist for your symptoms. And so it's more directing your care.
Yeah.
You know, what we do is we have designated providers in each specialty who are studying long COVID and interested in long COVID, and our referrals go directly to those providers,
And
almost
that's,
without exception. Sometimes it gets a little loosey-goosey, but for the most time, we're referring specifically to a group of providers in each specialty that we know are familiar with long COVID and with treating long COVID.
yeah, and that's really, I mean, you wouldn't go to a GI doctor to talk about your heart.
Right.
So I had a discussion, an interesting discussion, with a cardiology friend of mine here in Kansas City, and this was a couple of years ago. So, I, anyhow, uh, he's a cardiologist, and I told him, well, we're having problems getting people to be seen by cardiology, and he said, well, that's because you should be seeing your PCP, and I was like, no, 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 hold on, back this up here. I know your subspecialty. My PCP is not qualified to treat that subspecialty. That's why they're being referred to you. This is not a choice. You're going to see long COVID patients. Like, I don't.
Yeah, the challenge too is that the test that your PCP probably runs to check your cardiac function came out normal. And so that's when you need a specialist. And, you know, again, with long COVID, we're still not at the point where we have focused tests that can truly pick up on and identify what's going wrong with your body system.
Yeah,
So
exactly.
most of our patients see at least 3 to 4 different specialists within our program.
I think I've seen 3 to 4 cardiologists alone,
Yeah, yeah.
which is it's par for the course, and
Be a
that
little trial and error finding the right person too.
and that's it goes along with being the first to go through the jungle with a machete, hacking a path through the forest. Like, somebody has to go first. Makes it
Mhm.
easier for the next person and then the person behind them. And it's hard, and
Hard.
it's not.
It's hard. And you know, you wait a long time for appointments.
Yeah.
And and that's across the US health system, and I'm sure abroad as well, where you finally get an appointment with the cardiologist, but it's not for 9 months. And then you might get a cardiologist who says, I don't know anything about long COVID, and then you're back to square one. So it can be a really arduous process.
Yeah.
Which is another reason we'll talk a little bit more about
Yeah.
the benefits of long COVID programs. But an important part of our program is connection and support and resources. We don't have focused tests and treatments yet, but we do have each other. And so a large part of our um, group is really connection. So once a person is referred to us, they're part of the circle. So we do support groups twice a month for patients. We do a monthly caregiver support group. We have a monthly speaker who's an expert in long COVID, usually suggested by our long COVID population as to what topic they're interested in. And we, you know, we've had David Petrino and David Sistrom and plenty of big names, as well as a sex therapist who is local.
Cool.
So it's all over the board. So we do the support groups. We have a weekly newsletter that keeps people updated on COVID in the news, the latest research, and additional topics. Our patients have put together additional support services. They do an online patient support group drop-in once a week that everybody who is with us has access to. And they have a Signal group chat that goes continuously. And then they also have a channel on Discord, which is an online platform to connect with people.
Yeah. That
So
that's
there's a lot of ways to connect, and that's so important because while we wait for treatments, you can get a lot of support from people who are walking the same path, people who have tried something and it worked for them, people who have very similar subtypes of long COVID. That's been really valuable.
Yeah, and this is it seems like a very holistic approach as well, which is exactly what we need. Like you reiterated, this is not just a single function that's happening here. This is
Whole body system, and it's a whole family system, and it really affects every part of your life.
but yeah, and where can people get more information on the program at Brigham and Women's? Because there's
So we have our website,
okay,
which is the COVID Recovery Center at Brigham and Women's Hospital in Boston. That has our phone number. People are always welcome to reach out to me directly. My email address, I'll say it, letter J, Sullivan 9 at mgb.org. And that stands for Mass General Brigham. So jsullivan9 mgb.org. So we take referrals from within Mass General Brigham, which is our health system. External referrals can be faxed to us or called into us. And then we also have a phone number for self-referrals. So people can self-refer to our program.
that's fantastic. And do patients have to live in a certain area to utilize the services at Brigham and Women's?
You know, if people are outside of Massachusetts, sometimes they are not approved by their insurance to see our doctors. My feeling is everybody's welcome to our other programming. You don't have to see a doctor within our program to be part of the long COVID community.
Okay, that's great.
So I open it to everyone.
Wonderful to hear. Sorry, my phone is still like ding, ding, ding.
Yeah.
Hold on.
We do try to keep our support groups private,
Yeah.
just within our patient group, but the newsletter, the other features, join the party. Yeah.
Okay, I like
Yeah,
it.
the newsletter goes out to about, oh gosh, probably 4,000 people.
Oh wow, that's great. Let's see. What we already did that. How can I find a long COVID clinic near me?
Well, that's a challenge. You can Google it, but you might see programs come up that aren't real programs or programs that no longer exist.
Yeah.
And that's a challenge. They may advertise themselves as a long COVID clinic, but that just means that they have a physical therapy program that saw long COVID patients at one point after hospitalization. So what we really need is a centralized database of true long COVID centers. That's been on my back burner to want to try to pull together. I know we have the Survivor Corps website, but that was from several years ago, and it's not accurate anymore, unfortunately. But I would love to see an updated database. So my best suggestion is to Google your local hospitals. Generally, long COVID centers are associated with larger teaching and research hospitals. So that's the best place to start.
We have, and I keep forgetting to plug this in my own group. We do have a Google form where you can fill it out and tell us. I saw this doctor. This was my experience, positive, negative.
Mm-hmm.
This is something you would recommend. And I think the patient groups are a good resource to use.
Yeah, absolutely. We have a database like that as well, that our patients have put together with recommended providers.
Yeah.
Yeah,
it's that experience that we need. Like, I can go see a top cardiologist in Kansas City, but that doesn't mean that my experience is going to be the top experience.
Right. Right.
I went to my long COVID clinic near me. Oh, sorry. Just kidding. What should I expect at my first visit?
Well, it kind of depends on the layout of the clinic and what the program is like. So what we do, I can speak for our clinic. When you're referred to our clinic, you receive a welcome packet by email that has a letter introducing us, information about our support groups, a packet of research that's recruiting, and our weekly newsletter. And in that letter, we invite you to do an intake call. So the intake calls are done either by me. I had an assistant, and then we also have people within our phone system, schedulers, who can answer our line and do intakes as well. And so you'll do an intake with one of them, and then from there, talk about your symptoms, talk about what's going on, and decide what kind of providers are the top priority for you to see.
Oh, that's
and then we'll generate referrals from there.
Yeah, that sounds wonderful. And what should I expect? Let's see. what can a long COVID clinic do for me while I'm there?
Well, again, I think a big piece, and this is what I think is missing in some programs, because, you know, each long COVID program is so different. We don't have a standardization. Um, and I will, just as a little aside, we had hoped to standardize this as part of AHRQ, the Agency for Healthcare Research and Quality. And they had a grant to start 12 new long COVID programs and funded those long COVID programs. And so I was on the advisory committee to meet with them and talk about it and kind of talk about best practices and talk about what each program needs. You know, everybody needs a patient navigator. I think that's a really important piece of
Yeah,
it. Everyone needs a support group, ways for patients to connect. That's very important. But that was quickly axed in January with the
yep,
change of administration. So,
like not in
yeah.
every way.
But I think, you know, like I said, with ours, what you can expect is the intake and then immediately being invited to the community to talk to other people and to meet other people.
That's great.
You know, we understand that wait times vary between specialists. It can be a couple of weeks. It can be many, many months.
Yeah,
And
notice that especially with neurology, wait times are extremely high.
yeah, yeah, the demand for neurology, particularly autonomic neurology, is really challenging. It was challenging before the pandemic started, and now, and we're fortunate enough we have three certified autonomic neurologists within Mass General Brigham, and three other neurologists who are interested in dysautonomia.
I think you might have a rush on more of that now. So sorry.
Put your patient hat on, because let me
Right.
tell you how long the wait is for autonomic testing.
Oh,
We're looking well into 2026 for that.
yeah,
But, you know, this is why we're really trying to engage primary care more.
yeah,
You don't need a tilt table test to know that you have dysautonomia. You
yeah.
know,
It gets
you know,
clinical
you have it
sometimes.
every time you stand up, every time you try to move around.
Uh,
And so we're really trying to engage primary care more to manage the symptoms, in addition to what everybody knows already to do, the salt loading, compression, fluid loading. Most people have tried those first.
nope,
Um,
right here.
But to try midodrine, to try propranolol, you know, so that's our next objective. We've evolved our program over the years, and as we've learned and grown. And the next iteration is going to be really to try to pull in primary care more and do more close communication with them and rely on them more, instead of we're going to teach them to fish. Okay, whatever the analogy is, we want to
I
teach them to
just let
fish.
you know, you're good.
Yeah, we want to say, here are the symptoms, here are best practices,
Yeah,
and here's what we want you to do. Because access to specialists is really challenging.
I'm going to talk to you offline later on about that. I have some ideas. So
Oh, I'd love to hear them.
yeah,
Yeah. Mass
uh,
General Brigham has earmarked $400 million to support primary care. And so we're hoping that that will result in a lot more providers and shorter wait times and more education, um, et
yeah.
cetera.
And I
So,
think a lot of what the other aspect of this that we don't see as patients directly is that the pandemic had its effect on medical staff as well. A lot of people burned out, a lot of people walked away from medicine altogether. So we were already facing a shortage, and now we're facing an even more drastic shortage because
mm,
it took a toll, or it's still taking a toll on all of us.
yeah, yeah. And we know, you know, doctors and providers want to fix things and they want to help. And this is still not there yet. So often they feel unequipped to know what to do.
Yeah.
Um, you know, the other problem, while I'm kind of ranting a little bit, with long COVID programs is like you said, you know, you asked if we're open to people outside of our catchment region. The problem is that there are so few clinics and ways to connect with people.
Yeah.
Um, that if you live in a rural environment, if you live in certain states, there's really no long COVID care, no way to find providers in that area.
Yeah. Yeah, that's a big challenge. I'm from the Ozarks in Joplin, Missouri,
Hmm.
and thankfully, our clinic here in Kansas City at the University Health, they're still going. And they start, but the one on the other side of state line over at KU, they closed their doors a couple of years ago already.
Yeah.
So patients down in Joplin and other rural areas, they already have to drive like three and a half hours just to get up here. And even going the other direction, I don't think I think there's one small clinic in northwestern Arkansas, but beyond that, there's nothing in Kansas. And I've heard a few things in Oklahoma, but never anything that like stood out.
Mhm.
Where do you go, especially when you're sick? That's kind of far.
Yeah. All
That's
the more reason it would be nice
general.
to have a database of long COVID clinics and or doctors in each state that understand it or are willing to hear about it.
Yeah.
Yeah.
How do you tell what type of long COVID clinic it is and how their specialists actually communicate to one another? I guess I'm comparing the difference between two clinics I use. The team sitting together every so often and having consult regularly together is so much more better than the silos.
Yeah, that's a problem. We know that American healthcare is very siloed um, across diseases and disorders. So ideally, we would have three different specialists in the same room talking about a case. Um, but I can't think of any example of when that happens. It happens inpatient, but outpatient,
Yeah,
I think organ transplant.
yeah,
I think that's when you can get different specialists in the same space.
yeah. Cystic fibrosis, more specified stuff.
Very specific, more acute things. And so it is, that would be ideal.
Yeah,
Um,
would be.
but it's just not the way that healthcare is built,
Yeah,
unfortunately.
yeah. Foundation
We
was.
did try to have overlapping clinics, but that it didn't have that impact of people sitting in the same room, So most large health systems, they rely on referrals and they rely on intra-office communication and on the doctor's notes to understand what's going on.
And I think a really important thing for us to remember in this is make sure you have access to your records and that you have actually you've read them yourself. A lot of people, I typed, well, I did transcription for 25 years for every specialty, but I noticed in radiology in particular, most people don't pay attention to the body of a report.
Mm,
Even other physicians, they just read what's at the bottom under the impressions. They don't read
mm,
the body. And in radiology, we often use templates instead of typing out the whole thing. You use my normal template, blah blah blah. But they may add something in the body of the report. I saw this thing, but they don't put it in the impressions because they didn't think it was anything significant. But it
yeah.
might actually be something significant, like an MRI showing diffuse small white matter changes. That's actually kind of significant for us. It may
Mhm.
not be to the reading radiologist, but it is for us, and we need to pass that information on.
That's a great point. Yep. Labs that are maybe not so off that it warrants an alarm, but they're off.
Exactly.
That indicates something. Yeah.
I've gone through my own records many times, and every time I'm like, wait a minute, I have a nodule here, and y'all didn't say anything. Hold on, let's back this up because these symptoms match what I'm seeing in this report.
Yeah, and eventually as we learn more, you're going to get a fresh set of eyes reading over your reports and there's going to be a light bulb
Yeah,
moment where the pieces get put together.
exactly. Do patients work with a long COVID specialist over time, or do you just offer one session and refer patients to specialists?
Well, again, it kind of goes back to specialists, the specialists are your long COVID specialists, so you're working with, the pulmonologist who treats long COVID patients and thousands of them. So that's your person. So each specialist is your long COVID specialist.
Yeah,
Um, and most of them will see you for more than one session.
yeah,
Yeah, it's not a one and done. The only exception is we have neuropsychiatry, and we're fortunate to have an excellent neuropsychiatrist. And because of their bandwidth, he's only able to do a one-time consultation and then refer recommendations back to primary care or the person's mental health providers.
yeah. And that especially with neuropsych, they usually just do the assessment. They're not doing a whole lot of follow up with that. It's just giving the assessment so we have a baseline of what's going on.
Yeah, well, this is neuropsychiatry. So
Oh
this
no,
is a
sorry.
psychiatrist, yeah, duly certified in neurology and psychiatry.
Yeah,
And
no, yeah, that's what I'm.
oh, that's what you're thinking of too.
I used
Okay,
to
I thought
type. I
you're
used to
thinking
type a lot.
neuropsychology with the
No,
three
no,
hours.
no, no,
Yeah.
neuropsych. Yeah, no, I used to type for a neuropsych in Boston. He was, but he was at Massachusetts General. He's probably long since retired, but yeah, that's
Mhm.
he didn't see patients regularly. He would just do the assessment so that they could pass that back on to the patient's other physicians.
Yeah, but otherwise, it's at the discretion of the specialist that you see and what kind of issues are going on. And in most cases, they are prescribing treatments and want to follow you for that.
Yeah. What precautions like masking, ventilation do you use to prevent reinfection with COVID and other aerosolized respiratory pathogens? And that's a big discussion point.
It is, yeah, justifiably so.
Yeah.
Yep. Why every hospital doesn't require masking, why certain departments don't require masking.
Yeah.
So we follow hospital policy, which is to mandate masks only when respiratory illnesses are at peaks. So there's different times during the year where respiratory diseases are high, and then staff will be mandated to mask.
Yeah.
Um, what we can offer is you can always ask the providers to mask. I've not heard of ours not agreeing to do that. We do virtual visits whenever possible, for your protection, for your immune protection, and also to save you the energy of
Yeah.
getting into Boston and dealing with it and everything that's involved with an in-person appointment.
Yeah.
So, we'll bring you into the hospital for testing, and, if they need to listen to your lungs, if you need to be there. Otherwise, I think they will try to accommodate virtual visits.
That's amazing to hear that. Just that, again, the mindful and holistic approach to this is outstanding.
Yep.
What lab test do you perform to diagnose long COVID? Well, if that isn't the $1 million question.
I know, right? If only there were lab tests that would prove that you have long COVID. We don't have them yet. My thinking is that there's probably several subtypes of long COVID, and COVID acts on people's bodies in different ways, depending on your genetic makeup, hormonal influences, and your unique immune system. And so a positive test for one person may not be a positive test for another person.
Yeah.
And so it's going to take some time to sort out the different subtypes and develop treatment plans that go with each subtype. So I tell people it's like the fuse box that you have in your home, where with long COVID, there are multiple switches flipped. They're flipped in different combinations, and it's different for different people.
That's a really good analogy.
Yeah, so it's a matter of kind of finding out what your unique profile is and what treatments go with that. So we don't have standardized tests. I mean, they will do general lab protocol. They're going to look for abnormalities. They're going to look for anything that they can treat
Yeah.
and treat that, and that's a big piece with long COVID as well, is that if they can find something treatable, great. It's not getting at the root cause and stopping long COVID from what it's doing to your body, but it's treating. And so we do encourage people to, even though we know, you have dysautonomia, it's not your heart structure, it's not your lungs, we still encourage to get those completely checked out anyway, just to make sure that there isn't anything that can be treated.
Exactly. I think a lot of people assume that a negative test is a bad thing, but we're also ruling out, hey, it's not this bad thing though. And that's just as important to know.
It is, yeah. It is, but it's still disappointing.
It is. Yeah. I've been doing
when you
this
feel so sick and you have so many symptoms, and then to get another test that is unrevealing is just,
yeah. I think my biggest concern with the biomarker search is people are focused on finding a biomarker and not many biomarkers, because like you just said, I could go in and test negative for a certain biomarker, but someone else will. But does that preclude me from getting care? And I don't want to leave anyone behind. That really concerns me.
Research is addressing that. I can speak a bit to recover research, as they're doing many of the big clinical trials, and we're part of the 15,000 patient cohort. But they do a lot of biospecimens with each clinical trial, and they do a deep dive, and they're looking at who responded, who didn't, of the responders, what's different with them, of the non-responders, what's different with them. And so there's a level of decoding that's going on genetically and immunologically that is really very complex. And I think that kind of goes by the wayside, where, you might hear, oh, it didn't work, like just using this treatment didn't work. And it's like, well, it didn't, but what do we learn about it? About why it didn't work, how it can be tweaked to work. If there are people that it worked with, okay, we put them in their own category. So it's doing a lot of intense research as well, which is really exciting.
Yeah, and the comparative research and the comparative data sets, that really, again, going back 12 years, there was nothing for this 10 years ago. There
Mm,
is now. And it's something that is being explored. So
right.
hang in there, be patient. It's rotten, but we'll get there.
Yeah, and the biospecimen bank is huge.
Yeah,
Um,
sure.
and includes children and pregnant women and
That's great.
autopsy and long COVID and healthy cohorts, and so it's really a extremely robust uh, biobank.
Good here. Let's see. And this ties into this question. What symptoms can a long COVID clinic help with at this point, and what treatments are offered? And that's kind of too big to answer in an elevator pitch.
Yes and no. I think we've made just over the years. We opened in early 2021. I started in we opened in March of 2021.
Okay.
And from there to now, it's really amazing what we have learned and what we can do for people. So we're treating fatigue and post-exertional malaise. We're doing a lot of level 3 CPETs to try to diagnose why someone is having these symptoms. And so they're being diagnosed with preload failure and with mitochondrial disorders, and that will guide treatment. We're doing a lot of autonomic testing. Um, and then we're treating those according to the pathways. We're treating with low-dose naltrexone. We're using IVIG. Um, so a lot of different treatments. Not as much off-label as I would like.
All right. We can talk with Angela Rayerson about that.
Yeah, but we're treating, brain fog, fatigue, neurological symptoms, sleep disorders, you name it. Not every treatment, of course, is going to work for everyone,
Yeah.
but you kind of have to sometimes cycle through those too to figure out what's not going to work.
Well, and for people who are probably wondering what CPET? I know
Oh,
Monica does it down at UT or San Antonio.
it's a cardiopulmonary exercise stress test. So you've probably seen you exercising on a bike, and you've got a mask while you're exercising on the bike, and it's measuring your oxygen in and your oxygen out, and you've got electrodes attached to you. So we do a level 3 CPET, which is a little more invasive. So they actually are measuring the blood going to your heart and also measuring the blood going away from your heart. So you have two little catheters in a vein and an artery
Uh-huh.
while you're doing the exercise stress test. And so they can get a lot more data that way.
Oh, that's cool. That's great.
Yeah, yeah. So Dr. David Systrom has really led the charge on that. He's one of the big doctors in the fatigue space.
Yeah,
And so we're fortunate to have him doing research.
that's awesome. Yeah, and that's something that really, especially getting onto a mitochondrial level, that's really important.
It does, and that guides the kind of treatment
Mhm.
that you would seek, and the kind of supplements you'd want to take.
Yeah,
And that's part of my role too, is to talk to people, and they'll say, "Should I try this? Should I try that?" And I always say, "Well, think about why you're trying it.
yeah,
What symptom are you hoping to help, and what do you think is driving your symptom?" So as much as you can you try to figure out what's going on? Is it sympathetic nervous system overdrive and adrenaline dumping that you're experiencing? Are you having more gut dysbiosis and systemic inflammation? Are you having more vascular issues? You having just profound fatigue and PEM? So think about what might be driving those symptoms, and then what treatments would fit with that.
yeah. I
So
think
we do a lot of guidance with that as well.
that's good. That's something that another thing that concerns me in the community. People I feel like they're constantly supplement chasing. Oh, I'm going to try this. I'm going to try that. That just leads to burnout. I have not been a chaser. It's still important to try these things because we
Yeah,
won't know unless we try.
yeah,
But I think my previous experience with other medical issues, it's made me much more patient with long COVID. Like, okay, I'm gonna hold off, and I don't. If I try something new, it's only one thing at a time, so I know what's doing what.
yeah. It's hard to be patient, because
Yes.
if I were chronically ill, I'd probably want to throw everything at it and
Yeah.
see what sticks. But it's important, if you try a supplement, to add one at a time,
Yeah.
give it a couple of weeks, see how you feel. If it's not helping, go ahead and discontinue it. Um, so it doesn't interfere with something else,
Yeah.
and you're just ending up with an upset stomach and expensive urine. So kind of
Yeah.
be thoughtful about
Yeah.
what you're taking and why, and
And
you
what it
don't have to
does.
be on a large cocktail of it.
Yeah.
But if you can find a combination of two or three that you think this is moving the needle a little bit,
Yeah.
then that's wonderful.
Yeah, and that's exactly what I've been finding with my own fatigue. I've been on a medication for that for like 12 years now, but after long COVID, it just wasn't enough. So I found something that does work for me, and I still have to tweak it every now and then, especially after I had COVID again last month. So the past 2 weeks, I have just been flattened. So I
But you know,
what I was doing. And
you, like a lot of people with long COVID, are now the expert on your body and reading your body and knowing how your body is responding. And so you're like the scientist of your own body.
yeah,
Um,
exactly.
yeah.
And we just and when you are trying things, I think it's really important to remember it's not just pharmacodynamics. It's not just how the medicine acts on you. It's also pharmacokinetics, how you are acting on that agent as well. So it's a lot to consider before just going and trying something. So
Yeah. Yeah. Well, just be kind of thoughtful and pace yourself
yeah,
if you're going to try something off label or try something new.
yeah, and take careful notes. Like I think we haven't really used symptom trackers as much recently, other than things like the Visible app. I know at
Mhm.
first we were all using different apps to like track everything every day, but after 5 years of that, it's like, okay, hey, look.
Yeah, you're like, why am I writing this down? Um, but it would be good to do that if
Yeah,
you're trying a supplement for fatigue, to decide on your own 1 to 10 scale and just see, for
yeah,
2 weeks if you're noticing a change.
yeah, and it's important to do that, regularly so you can go back and look. Like you might think over 2 weeks, maybe this, but actually looking at what's going on and noting that change over time.
Mhm.
Will being enrolled in a long COVID clinic help with getting access to treatment for underlying etiology if, for example, it turns out that viral persistence or reactivation of EBV is the root cause of continued symptoms when treatments become available in 5 or so years? EBV, uh, Epstein-Barr virus.
Epstein-Barr
Sorry,
virus.
no,
Yeah.
I'm thinking Ebola.
I think definitely. But again, it kind of depends on how the clinic is set up. Like for us, there's no getting admitted. Like,
Yeah,
it's not like, oh, thank you for, letting me join. It's like you just are. You're part of it, and there's no beginning, middle, or end. You can kind of stop participating whenever you want. Um, but you're kind of in it with us until you don't want to be.
yeah,
And we do so much education about research and about upcoming events and about new treatments that people will be aware of that. But definitely a hospital that has a long COVID clinic is most likely doing research, and they'll be the first to know about new treatments and be trying new treatments.
yeah. And I think it's even if you are seeing a long COVID clinic, I will still go in on my visits, or I'll email my doctor here. Hey, they're doing research on this right now. I told them about baricitinib a couple weeks ago. He hadn't heard that. So bring that information in with you, or email it in advance. Or
Yeah. And, I've talked to people who have said, well, I saw a cardiologist, I had COVID in 2020. I saw a cardiologist in 2021. They said everything's fine. So I said, why don't we
2021.
revisit it? You're
Yeah,
still having heart palpitations. You're still having symptoms. It's a very different world than it was a couple of years ago. And
no
so
more.
someone looking at it with the knowledge that we have now may be able to come up with another idea or another treatment.
Yeah, and we simply know more now. We have more data now.
Hmm.
I was telling you yesterday or day before about wrestling with my endocrinologist.
Hmm.
He's a great doctor. I will not knock him on that. But he was talking over me, and he's like, "Well, we don't have the data." And I finally just said, "Hey, look, pal, we're just gonna agree to disagree on this. Stop talking over me. We are the data. We need you to collect this."
Hmm.
But we already had a lot of data on what he was referring to, so I went home and started making these advocacy cards. And the one for endocrinology in particular is actually a review of endocrine literature in long COVID.
Yeah.
The next time I saw him, I was like, here's your data.
Yeah.
So and that's it's important to be polite but also be assertive sometimes. So,
Hmm.
no,
Yeah.
actually, there's stuff out here. Let me help you with that.
Right. Right.
Which is we shouldn't have to do that, but
Didn't have to do that.
yeah,
Yet here we are.
can do it. Yep.
Yeah, I mean, you'll find that you often know a lot more about the disease than the specialist that you're seeing,
And
unfortunately.
it's not any knock on them either, because yeah, like my PCP, he sees patients 12 hours a day, 4 days a week. I don't know how he has time for anything.
I know. But here's the thing. I don't give them a pass like that. You're
Yeah.
being very gracious
Yeah,
because
yeah,
it's been 5 years.
yeah,
Why don't they know anything about long COVID yet?
yeah,
We've known about it forever. People are still coming down with it. COVID is still prevalent year round. And so I know people are busy and I know they have other specialty interests. But to me, this is a systemic and widespread chronic illness that even if you don't see lots of patients with long COVID, you should be familiar enough or curious enough
yeah,
to be able to manage a patient with long COVID.
yeah.
At
That
least to be able to
curiosity is
direct
important.
them and guide them.
Yeah, and I props to my PCP. I was his first COVID patient, period.
Mhm,
And at the time, I didn't have insurance, so those first few months, I got sick March 6th, 2020. We were just doing telehealth and email and phone calls, so I wouldn't have to go all the way up there to see him, and it kept my costs down too.
mhm,
But every time I see this man, he will sit down at a computer with me, and we will do research together on, hey, oh, tell me more about this.
mhm.
Not every doctor can do that. I get it, but I appreciate that in him.
Right, but when you find one,
Right? Yeah, and if you're in Kansas City and you want his name, reach out. He like he's used to this at this point.
yeah, yeah. But shop around. As
Yeah.
hard as it is, if you have a PCP who won't listen to you and doesn't have any time for you,
What's
next.
the point? Yeah.
Yeah,
It's
you're
not.
their customer, and so you deserve to be heard and listened to.
Yeah. And he's not the only PCP. Well, and that I mean, with rural health, you see, like, my dad's a rural hospital administrator. Sometimes there's a
Yeah.
desert.
I mean, it's easy to say get another PCP, but
Not when they're 4 hours
sometimes you
away.
can't.
Yeah.
Your insurance won't let you. There's no PCPs to be had. Your first appointment is a year away. So that's a whole conundrum too. But I don't know. It's
Yeah. No, there are no good answers right now,
American healthcare.
especially as we're falling apart here at the end of the apocalypse.
Yeah.
So, how much time is allotted to an initial appointment? I'm trying to figure out how many questions I can bring so I know how to prioritize. Yep,
Ask when the person calls to schedule because it is different hospital to hospital. Our new patient visits are 40 minutes.
that's good. That's really good.
Yeah. And they do try to run a tight ship.
Yeah, yeah,
So it starts when it starts and it ends with it ends
yeah.
when it
But
ends. So the next
yeah,
person can get in. Yeah. So you do want to make sure that you allow plenty of time. You get there early, you log on early,
get your
your
stuff
ducks in a
organized.
row. Yeah. Yeah.
Write things down and don't like write it in paragraph form. Don't do that to yourself. Make bullet points of what you want to cover.
No, bring someone with you to
Yeah,
take notes.
you're in
Bring a
Kansas City.
support
I'll go with you.
person
Yeah,
and
I
have
literally
them. You
done that.
do the talking and they do the recording.
Yep.
Yeah.
No, I've literally done that for several people here in Kansas City. If I can't make it in person, they'll pull out the phone.
Also, if they're making an important point or explaining a process that you want to remember, you can say, "Can you make sure that that goes in my notes so I can read it later?"
Yeah, that's an excellent point.
Yeah,
How can you decide what is important to share and what's not when you have so much going on? That's a great question.
that is a really good question. Um, I would say keep the focus on the specialist that you're seeing. So if you're going to see a pulmonologist, keep it focused on your shortness of breath, your exercise intolerance, your fatigue. Even though brain fog might be your biggest
Yeah,
concern, you don't want to spend those 40 minutes talking about that. Um,
yeah,
you could, if you had time, you could bring it up at the end, and they may or may not be in a place where they would refer you to a neurologist or something like that. But keep it focused on what that person is most likely to be able to help you with.
yeah, yeah, and don't. I don't want to say don't, but try to be as concise as you can too, because sometimes, especially with brain fog, you'll slip like a word or a phrase in there that sets them off on the wrong path.
Yeah. And so,
So,
like you said, with the cards, it's good to have, 3 points. So you could say, I want to talk to you about these 3 things. And then if you send information in advance that
uh,
kind of tells your story and talks about your symptoms, they'll have that in advance as well,
yeah,
so that you don't have to explain it over and over again. One thing is I encourage people to kind of try to stay in the present as much as you can.
yeah,
So you're going to see your specialist, you don't need to say, well, I got sick in October of 2020 and I was so sick for 2 weeks and
Yeah,
these were my symptoms and blah, 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 blah. Nope. Where are you at now?
yeah,
Because, that won't impact your care now.
yeah,
So got sick in 2020. I was very sick. Now these are the symptoms
yeah,
that
yeah.
remain.
And let
Yeah.
them know how many times you've had COVID, because at this point,
Yeah, yeah. And the hard thing is that for a lot of people, they want to tell their story and they
you
want people
do.
to understand what
Yeah.
they've been going through and what they're continuing to go through.
Mhm.
And it's
Really
really
hard.
important to do that and to be able to talk to people about it.
Yeah,
And you might hit upon a doctor who's like, give me it.
yeah,
Um, but in most cases, even if that's the first doctor you've spoken to who understands long COVID, try to keep it for your own sake as focused as possible so you can get the most out of it.
yeah, exactly. Let's see. How can I effectively communicate with my healthcare providers? I feel like they're not listening to me. I hear that a lot.
I heard a lot. I heard a lot too. Yeah. Um, I encourage people to ask questions.
Mhm.
What do you mean by that? Can you explain why my heart is behaving this way? What are possible contributors to my brain fog? What are medications that we can try for brain fog? Um,
What are you not willing to try? I heard that one yesterday from someone. No.
yeah. Are you interested in research? I can send it to you on brain fog to try to turn it back to them.
Yeah.
Because being told, I, I don't know anything about long COVID. Well, you're
Yeah,
still
you
the
do.
doctor that's in front of me. So
Yeah.
you got
Sorry.
me for 40 minutes and I'm going to tell you about long COVID.
Right? And you don't have to know all of my long COVID. I need you to know, for example, this aspect of my cardiology component of my long COVID. That's why I'm here.
Yeah. Or to be asking the right questions,
Yeah.
or even just addressing each symptom and
Yeah.
saying, well, and if there's enough, like, I don't know, I don't know, I don't know. It's like, well, do you know, is there someone you recommend that you can send me to
Yeah.
who might know? Or are
Yeah.
you willing to learn if I send you research?
And if
So,
it, yeah, and don't be afraid. Like your doctor should not get offended if you need a second opinion. In
right.
fact, most will welcome it, because sometimes if they don't know, yeah, hey,
Yeah. And I
Dr.
can tell
So-and-so.
you from working with doctors all day, they don't care if you get a second opinion.
Yeah, yeah.
Great. If they can find out something else that's different, great.
It helps them
Or if
too.
it gives you peace of mind to have another person say the same thing,
Mhm.
great.
Yeah. Yeah. Don't think you're gonna hurt their feelings, because if you do hurt their feelings, maybe that's not the doctor for you.
Right, right. If they're that sensitive.
So yeah,
And also, you're not there to placate anyone's feelings. You're there to get answers and you're there to get help.
yeah,
So you
yeah,
bear enough burden without having to worry about how someone else might interpret you.
yeah. Just put that luggage down. It's not yours to carry.
Yeah.
Let's see. How long will I have to wait to see a specialist referred to me by the long COVID clinic? And that, I don't know, 5 days, 5 years.
Yep.
Wait, really?
Yep. 5 days. Year and a half. No. It does depend on the specialty. Then you can ask how far people are booking out. For our clinic, we kind of can give people in some specialties, we can give them a bit of a preferential treatment to kind of move them to the front of the line, which is nice.
That's good.
Otherwise, you might be lucky and be able to get into a service within a couple of weeks,
Yeah,
or get someone cancels and they pull you into that spot. So ideally within a couple of weeks, but in some cases you're waiting over 6 months.
yeah,
And for some tests, you might be waiting a year.
yeah, yeah. And I think, and I was telling you about the ER town hall that we did with Taylor Nichols. Don't think that going to an emergency room is going to get you seen and diagnosed any faster, because that's not what emergency medicine does. They are there to stabilize. That's and it's really rotten having to wait when you're having the symptoms right now and you don't know what's going on.
Yeah.
But we
But I
still,
always tell people too, though, but if you feel like you're having a heart attack, you
we
feel like
go,
you're having a
yeah.
stroke and your symptoms are that severe, go get
Oh,
checked out.
yeah. Don't wait on that.
Yeah.
I would rather
Don't
have
say
it.
that. Yeah,
Yeah,
for sure.
yeah. Well, I have actually another town hall on exactly that. On, do
Hmm.
I think it's a heart attack?
And it might be that you say to your primary care, look, I've been to the ER 3 times in 2 months. What are we going to do about the heart palpitations?
Yeah,
you know, we got to try something. We got to get into the right kind of cardiologist or the right kind of neurologist.
Yeah,
But
that's
it's hard, you know, because you're
true.
having to do so much self-advocacy for a syndrome that's still poorly understood, um, politicized. Um, it's hard to get care, and you're having to be the quarterback of this team while you feel so sick.
Yeah,
So, you know, I want people to really give themselves credit for the resiliency that you have.
yeah,
You know, well, long COVID research wouldn't be this far if it were not for people living with long COVID and their advocacy.
yep. And coming together and comparing notes.
Yeah,
Be
and insisting on answers and insisting on research.
Yeah, and that was the very first thing we did in my group was to make a symptom list. And if we don't care about correlation or causation. If you've got it,
Mhm.
put it on the list. We'll get that later. And one of my admin or one of my moderators at the time, she's like, "Hey, my teeth are cracking," and I'm like, "Oh, only you, Emily. Put it on the list." 300 people were like, "Me too," and it was okay. It's a thing. It's a thing.
Yeah, yeah.
You never know until you say something. So say something.
Say something. Yep.
If I had general labs or imaging done back in 2020 or 2021 after my first infection that yielded no significant findings, should I still try to find a way to have those forwarded to my clinic prior to my initial appointment, or should I wait to be asked? Please send them. Please, please.
Well, I say no. I don't know. Your energy's precious.
Yeah,
And
I know.
if you're going to send, I wouldn't waste your precious energy sending unrevealing reports that are several years old.
I see the reason I say that is because I went back and looked at my echocardiogram, and on the impressions it was like normal, not in the body of the report. And that's why,
Well, so in that case, that would need to
yeah,
be forwarded.
yes,
But if everything was normal, um, you know, you can ask them at the time. And also, there's so many ways to share records.
yeah,
So make sure that you go into your gateway of every hospital system and click
yep,
connect, 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 because they can pull over all those records. Kind of gone are the days of having to print out and fax and do all of that. In most cases, you can share them through their internal system, or medical records will do
yeah.
that for you.
And that's one wonky. That's the only thing I don't like about my long COVID clinic here. They don't use my chart. They're on a proprietary
Mm.
system unique to them, and it's like, oh, come on, guys. In this day and age,
Yeah.
they're a research and teaching hospital. It's a public hospital.
Hmm.
So that's one problem that you might run into.
Yeah.
But yeah, and again, getting back to the whole brain MRI, even back in 2020, 2021, they were saying, oh no, diffuse small white matter changes consistent with normal signs of aging, not a 30-year-old.
Right.
And
Right.
that is never passed on. So I think it's a good idea to have, especially if you're talking a brain MRI, have baselines
Yeah.
that you can compare.
So yeah. So your point is important. Yeah. So if you have the capacity and you can do it, do it.
Yeah,
But don't
don't overdo
throw
it.
yourself into circles if the results are not going to be immediately needed for that appointment.
Yeah,
We have ways of getting the information.
yeah, exactly. Let's see. I have trouble following through on getting ROIs to move data. This is a great segue to move data from one healthcare network to another because of brain fog and the number of steps this can take. Can a long COVID clinic help me with that via a care navigator or case manager? That's a great question.
Depends on the long COVID clinic and whether they have a care navigator. You know, we do. It's me, but I'm also everything else. Um, so I can help with that, but generally I would probably defer you to the department that does that, medical records, and walk you through the same things. Share your records, share your records.
Yeah.
You know, and then the end result, okay, well, fax them and have them directed to me.
I,
But
ideally,
you know, enlist support again, because
yeah.
it's all a matter of how you use your energy judiciously.
Yeah.
And so get someone who doesn't have fatigue and brain fog to do that, because they can
Yeah.
get it done and it's done, and then you're not left.
So I'm going to throw myself out there, and hey, if you need help with that, let me know. We'll find someone. Okay.
Wonderful. Yeah. Yep.
Yeah. I might be asleep for 2 weeks, but reach out anyway.
Yeah. And you know, when you're ill, there's always people who say, you know, let me know if I can do anything. Yeah, you can come over and do 2 hours of this task.
Yep. Bingo.
Bingo.
Yeah, and it's okay to ask for help and be specific. Your friends don't know you need help unless you say something. And believe it or not, they might actually really help.
Yeah. And they might develop more empathy for what you're going through.
Yeah. How do you make sure you're in the best shape possible, like not in a crash, prior to your initial appointment at a long COVID clinic or any appointment, really, so as to be able to advocate for yourself effectively? Are there techniques or meds that can help me get into good rest and sleep the night before?
No. I mean, what I tell people, this has happened a number of times where I've been on the phone with them and they're just like, I'm so nervous to make the appointment because I just don't know how I'm going to feel.
Yeah,
And my answer is, let's make it a virtual visit.
that's great.
Make it a virtual visit. And then if you feel better and you want to switch it to in person, we could do that. Or let's make it in person. And then if that week, the week of, if you feel lousy, let me know. We'll switch it to virtual.
I'm gonna nominate you for a Nobel. So thank you
Oh,
for
me.
that.
Um, yeah, I think that's the way to do it. And what you don't want to do is put yourself in harm
Yeah,
by physically getting to an appointment.
yeah.
So
And,
even, a telehealth appointment or have somebody with you. The other thing we have at our hospital is we have valet parking.
oh,
We have wheelchairs. If you don't have someone to go with you, then you can have in advance arrange for one of our staff to help that will take you by wheelchair to your appointment.
yeah, and make sure you know where it is. That was my first gripe with my clinic here. It's not in an easy to find place. There isn't really signage, there isn't guidance on the website. And I've had people who were trying to go for their first visit. They were like, I'm out of spoons and I don't know where it is.
I know, yeah,
I called up the clinic and I was like, hey, we got a problem. Can we fix this?
yeah,
They're confused.
yeah. I send people a map.
That's great.
But you need to, the map is also on the hospital website. And, it's going to be in a weird place. It's usually not going to be like long COVID clinic.
Yeah.
Ours is in pulmonary
Yeah.
lung center A. Um, so you do want to
Yeah.
pick the spot and park in the best place you can.
Yeah. And when you're in a system like that, there are multiple buildings. So
Hmm.
building.
And they cross streets and
Yeah.
we've got Children's Hospital and Dana-Farber connected to us via walkways, and it's
It's like durable
it's
tunnels.
a maze. Yeah, it is. It's like a big gerbil farm.
The last question, what else can a long COVID clinic help with?
Okay, so in my view, the way I view our medical clinic, our long COVID clinic, is the medical piece is a very small piece of it.
Yeah.
The big piece is the community, the connection, and the access to resources.
Yes.
So that's been the priority for this clinic as I've developed it over the last couple of years, is giving people an opportunity to meet each other, giving people an opportunity to talk to long COVID experts, hear from long COVID experts, have access to research, and have access to symptom management strategies. So to me, that's the big piece of a long COVID clinic that should be there. It's not always there. Sometimes it's a couple of really good doctors, with their hearts in the right place, and that's what you have.
Yeah.
But it's nice if you're going to one um, to see if you can build some community around it.
Yeah.
And if you can't through the long COVID clinic, it's important to build community somewhere.
Yeah.
An online space like this is wonderful. People who aren't in online spaces, there's still other ways to meet up and connect and find each other. But I think that's really important. So that's what we do, Um,
I think that's probably the most important thing. We did a documentary that came out in January 2021. And I knew when it went live on YouTube because my DMs just exploded. It was like half of Cuba. And I didn't know what was going on at first. I'm like, okay, what kind of spam is this? But someone took a picture of their TV and I was on it and I was like, oh my God,
wow.
these people have long COVID. They didn't know what was going on. So I got someone from my group who's a native Spanish speaker. Hey, here, I need you to talk to them. My Spanish is not, I mean, I can, but like, you're better.
The truth is everybody knows someone with long COVID, whether they're aware of that or not. And then also the other truth is almost without exception, everyone I speak to, and it's been thousands of people at this point, they're the only person that they know with long COVID. And so it is important to keep talking about it. Don't be ashamed of your symptoms. Don't hide away. You have a right to occupy
Yeah.
space in a way that makes you feel safe. Um,
It's a
you
great
know,
success for you.
but it helps to be connected with other people. So you have the courage to do that and you feel supported doing that because it can be very isolating.
It is. It really is. I mean, I like the first year or two, every single person who joined my group, every person who reached out, like especially once the YouTube thing came out, it was all of South America. It was most of Africa, parts of Asia. People
Wow.
who had never even heard of anything long COVID. They didn't know, but they all said the same thing. It's the sickest I've ever been. Everybody thinks I'm crazy. I think I might be crazy, but I don't know what's going on.
And there's such a spectrum, I'll talk to people, friends who think they're healthy and they'll say, yeah, I had long COVID. Yeah, I got over it, but I've never been able to work out in the capacity that I did before. And I've never
Yeah,
regained my sense of smell. I'm like, that's long COVID. You're
yeah.
functional, but
No,
that's
I
long
don't.
COVID.
No, no, I don't have long COVID. Okay, well, you would not have this condition had you not had COVID. Period.
And the light goes on. They're like, wow, yeah, I do.
You do. That's a common
Yeah.
conversation.
So I think there's a lot of people who have not put those pieces together. I know with referrals to our clinic, we still get 100 referrals a month. So we've had 6,000 patients who've come through, and we still get 100 a month.
Wow.
Has not slowed down,
Yeah.
and they're from all parts of the pandemic.
Yeah.
People who got sick with this newest variant to people who were sick in April 2020 and are just now finding their way to us. So
Yeah.
it, the need for support is still out there.
And I've seen a shift in also people joining the group. At first, it was the patient coming in saying, "I have long COVID," and then after about 2 years, it was, "My doctor thinks I have long COVID," and that was really good to see. Like, oh my
That's
God,
really good to hear.
that's great.
That's really good to hear.
Yeah. So we're getting through. Keep
Yeah.
going. Tap out when you need
The
to.
thing that keeps me in advocacy so much is that people with living with long COVID are tremendous self advocates, but
Yeah.
you're also the people who are ill right now. And you need people who are not suffering from long COVID to
Yeah.
push through, and to keep advocating and keep pushing for you on your behalf.
Yeah.
And so we need the long COVID community that includes people without long COVID
Yes.
to be strong advocates.
That is exactly why I reached out to you because I see you doing that, and I'm
Oh,
grateful for it. Thank you. So,
it's
oh,
my honor.
well, one other quick thing: your long COVID, like my long COVID clinic, also has resource, like social services resources. They have a small food pantry, so say something. Speak up. You don't know unless you ask, but
Mhm.
they might not know to ask you. So
Right, right.
keep being vocal. Take a break when you need to. Tap back in. Let's fight.
Yeah, yeah, you got to stay in the fight, but you have to be in a place that feels good for you. And it's okay to rest. And it's okay if things get a little overwhelming to take a step back.
Absolutely.
I have taken a step back from watching the news and
Yeah.
all of the changes because,
It's going to change tomorrow anyhow. So
right. And that's the name of the game is chaos. They're just creating
yeah.
chaos. And that's how they keep us, yeah, spinning. So,
I've had people who were in the group like 3 years ago. They're not in the group anymore because they just got burned out, and they'll reach out.
mhm,
Hey, what's new? What should I know? Well, let me tell you.
mhm. And yeah, and you
Okay.
could turn off notifications and
Yep.
just check
Sometimes
in
I
every once
do.
in a while. But yeah, we need you in the fight. So you got to take care of yourself and pace yourself through it.
But thank you so much for this excellent conversation, Julie. I appreciate you so much, and we'll stay in touch. Okay.
I appreciate you, and
All right.
I'll talk to you hopefully, I don't know, hopefully later today.
I will text you right after I'm done recording. So
Thank you, and thank you to everybody who's tuning in.
yeah.
I appreciate your time.
Have a great day.
You too. Bye-bye.